themselves. Obviously, it's the winter time. We're in Albany. Most of us have a little bit of a runny nose. That's going to make it take a little bit longer to get absorbed.
What is the cost on that?
The cost of these is about $20 a piece. All right, I think the bag itself is about $1. I think it's 75 cents for $1, and the drugs themselves are somewhere in the neighborhood of $16 to $24 for each one of these boxes, depending on how it's the buying group or buying power of the folks that are buying. The atomizers themselves are a couple of dollars.
You also have a mask in here.
The mask is so you can give assisted respirations as well. And we spend a little bit of time talking about that. But the most important thing to get on board first is the Narcan, and then also to assist with respirations as well. Those masks actually work reasonably well. Not great, but reasonably well. Reasonably well. And in terms of people trained, we trained 2,000 EMTs in New York State with a brief video that was actually done by the AIDS Institute with some support from the Bureau of EMS, both Department of Health, and Hoag's Corners Volunteer Ambulance in Rensselaer County. And that training video was used for Rochester Fire, the Suffolk County Police Department, Suffolk County EMS agencies, and most of the other EMS agencies in Rensselaer County that are operating at the basic life support level. And we had well over 200 reversals with no harm to any of the people that got reversed, and no harm to any of our providers, which was also profoundly important to us.
Are other emergency rooms providing this resource?
We'll be the first one in New York State to be doing it as an emergency department. We're currently surveying emergency medicine physicians and nurses across New York State to make sure that we can address as many of their concerns about getting involved in a program like this as possible, so that we can get their buy-in and create educational materials for them so that they will see that community access naloxone not only saves lives by the administration of the naloxone, but just by having the discussion with somebody about risks of overdose ends up reducing deaths by overdose. In Massachusetts, they've seen drastic reductions in overdose deaths associated with community access naloxone programs that can't be explained just by the Narcan itself. And in New York City, they've seen similar results with a precipitous decline in deaths from overdose, along with the expansion of the community access Narcan programs down there. They've been very successful. You're welcome.
Sean, it's really quite.
You're welcome. Probably one of the most fascinating things about this has actually been the partnership between law enforcement, EMS, and the community access naloxone programs making this work. And they've taken a couple of different tacks, both within the existing community access structure, as well as our formal program involving EMT training, and now EMT and first responder training at the last department as well. You're welcome.
Senator Montgomery.
Yes, just a quick question. Recognizing how teenagers travel in packs and they sort of do everything in groups, and it sounds like, based on what I have in front of me, that a large number of the overdose cases are really young people, older teens and young adults. I'm just wondering what would be the possibility of making something like this, and I don't know, more accessible and teaching young people how to save each other, so to speak. And I guess, you know, I'm a huge proponent of school-based health clinics, which are basically the health providers for young people, if we have them. They would be. Are you looking at that as also part of a way of addressing this wave of deaths among young people based on this drug problem, this new emerging drug problem?
I have an interesting position in this. I'm the regional EMS medical director for the town of Colony. I'm an emergency physician at the hospital, but I'm not actually the single spearheading person behind all of this across the state, although I seem to have almost fallen into part of that role. This has come on and actually taken me by surprise in terms of how much support we've gotten for this and how successful it's been as we've moved along. I know that one of the things that we've talked about already and we've initiated conversations for is Clifton Park. If you saw the newspaper locally over the weekend, there was a situation with one student injecting another student that made it into the newspapers in a school district there. This is certainly something that we would be happy to take to them in concert with the existing structures within Clifton Park to assist them with developing a program there. But this is something where actually any physician can register to become a community access naloxone prescriber, working with the state and then get the supplies through the Department of Health, and then they would be able to continue to pass that forward. I would turn you particularly to Sharon Sandcliffe from the Harm Reduction Coalition for some specific ideas on some good ways to move this forward.
Thank you.
She's been a fantastic partner in this.
Thank you very much.
Thank you.
Thank you.
Do you want this back?
Yes, you should take
There's
it.
your son.
Now from the Rensselaer County Department of Public Health, Teresa Darkangelis. You can state your full name and your position in Rensselaer County.
My name is Teresa Darkangelis. I am a substance abuse prevention counselor with the Student Assistance Program through Rensselaer County Department of Mental Health. I have, so far in my social work substance abuse career, 20 years of experience working with young people and their families. First in drug treatment centers, with Concord Park and Paul House. But for the bulk of my professional career in Rensselaer County Mental Health, doing prevention, education, and intervention. I work with a team of people who provide prevention, intervention, and referral to students through OASAS funding and school district funding, sort of a matching system. I have been proud to be a part of a movement that until recently has shown a consistent reduction in adolescent drug use for over a decade and a half. Unfortunately, that downward trend has not continued. And while heroin, prescription narcotics, and other opioids have taken center stage today, our young people are at risk for use of many drugs, some still organic, but many more synthetic or designer drugs such as ecstasy, bath salts, synthetic marijuana, and methamphetamine. Drugs that impact the teenage brain in equally devastating ways. Regardless of which drugs our teens are using, the increase is alarming, culminating the trauma and tragedies of young people and their loved ones whom we've heard from today. Some reasons for the increase seem to be associated with the trend of internet sales of prescription drugs and pager dope, where a young person or any person using at this point can call their dealer and have their drugs delivered to them. And that's directly contributed to the rise in heroin that we see now. But I would be remiss if I didn't mention the recent impact of the legalization of marijuana by some states for medical and recreational purposes. It has confused children and adults as well. The layman's interpretation of what they hear in the media is if a doctor prescribes it for someone who is sick and it makes them better, it must be okay. And that simply is not true. Misinformation is rampant, as evidenced by a middle schooler recently telling me that she believed that marijuana cured cancer. But education regarding the dangers and consequences of drug use is not enough to inhibit young people from using. Clearly, it is important for adults and parents to understand the dynamics of the negative consequences, but also the results on the teenage brain in regards to drugs' negative effects, so that parents take the issue seriously with their children at a very young age by speaking team early and often about their values regarding drug use and their family consequences should a child use. These are scientifically proven prevention methods that help teens to resist the pressures to use drugs, and proven effective parental techniques are critical as well. Preteens and teens need to learn how to deal with the more complex adult situations and emotional problems as they go through adolescence. And when they turn to an artificial means to cope, they have difficulty reversing the lure of what that appears to be an easy out for them. The average age of use nationally is 12 years old. And we're talking about 6th and 7th and 8th graders who begin using marijuana and alcohol. There are so many people here today putting their heart and soul into this issue, and I'm right there with them. But I don't think there's one person here who doesn't wish that each and every addicted child that they have had or treated had not started using it all, and that their addiction could have been prevented. My program team through the county has been cut in half since I started in 1996, and my colleagues and I are not able to reach the number of students and parents we need in order to effect change. I'll give you an example of how we work with students. We teach them to identify the risks of using, but also give them the skills to resist pressure to use. We help them with conflict resolution, identifying negative feelings, and establishing a healthy self-image and goals. This is not an easy profession to be in. It requires passion and dedication, as those who have had family involved in addiction can attest. The scientific knowledge that we have gained through adolescent brain imaging has given us insight into why prevention is so important. The reward pathway that is reinforced so strongly with drugs in the adolescent brain has dire consequences. The pleasure pathway gets reinforced so much more easily in adolescence, and it is almost impossible to unlearn. For example, if we all try to learn a language or play the guitar at the same time that an adolescent group of young people did, they would learn it faster. We would try harder. But regardless, they would learn it faster because their brains are sponges, and those neural pathways are just firing at speeds that our brains no longer are. Unfortunately, they learn the addiction pathway faster too, and that just gets reinforced very, very quickly. Research out of Duke University has shown evidence of an 8-point decline in IQ in adolescent marijuana users, that they do not seem to get back. It doesn't resolve itself into adulthood. Funding has not been sufficient at many levels of care, including the long-term aftercare that Patty referred to. But I want to plead to our government officials to allocate funds that we put much more effort into preventing the use and subsequent trauma and tragedy to young people. And that begins in elementary and middle school level children. In my April Park community, many of the heroin deaths we have experienced in our young adults began in middle school with marijuana. And the prevention and early intervention is critical to the health and happiness of our young people.
I just have a one comment or question that I think I'm hearing you say, that when we have access to broad-based mental health services in our schools,
Yes.
that's one way to prevent this epidemic. If you want to reach kids and help them have resources or access to the supports if they're having difficulties, there needs to be supports other than a quick fix.
Right.
So are you seeing the mental health services in our schools getting cut back because of school aid cuts? Do you think there's a correlation there that we should be following?
Absolutely. I've been in schools for 18 years and 4 years in Nassau County. And I've seen many colleagues, social workers, psychologists, nurses, and obviously my substance abuse prevention team as well, through, lack of state funding or federal funding. Children are dying to talk about this issue. They are curious, they are confused, they see things on TV and the media and the internet, and they don't understand, and they think it's okay. And, they're smart, and they've seen a lot of the devastation that has happened as well. But we need to continue to support them and give them the means and the direct contact to talk about what it feels like to be a teenager, how to cope with different emotions, and things that are happening with conflict and such.
We're seeing some continuing threads, and one of them was the lack of insurance. That Medicaid was sufficient for coverage in many instances, but private health policies weren't. What has been your experience?
In the prevention realm, we don't deal very much with Medicaid-based treatment. We are in a fee-for-service agency. So, resident and mental health is, but I'm in the prevention department, so we work directly with schools.
Restricted to
And we assess them, yes.
Thank you very much. And now that we've finished the public sector, we'd like to now begin to deal with the not-for-profit sector, including but not limited to faith-based organizations. And I see, I believe in the distance, Sister Phyllis Herbert. So if you would like to come down, who's been the head for some 30 years, Honor Court, City of Albany.
Good morning.
State your name, your title, and a little background before you proceed.
Thank you. Sister Phyllis Herbert, I'm director of the Honor Court program and the City owns housing industry treatment. And we're an alternative to the incarceration program. But we're also we're at the forefront of anyone who tries to get into treatment and just doesn't know where to go. We act in that manner for the agency. We see an increasing number of young people, adolescents as well as young adults who are addicted to heroin. And as many have pointed out here today, it seems like the basic reason they got involved in it is the pills are much more expensive to try to obtain. They usually start out on pills in maybe an innocent way, or at least just trying them out of their medicine cabinets. And they then find it more difficult to afford oxycodone and Nortez, etc., that are in the, once they've used up their parents' prescription, or at least half of it anyway, then they try to get it through other means, and it's expensive buying it through other kids. And that's how I came into contact with many of them, because they got arrested for possession either of the controlled substance or something happened, something occurred that brought them into the courts. A number of the teens were in situations that caused them to be very ill. One young woman who was from Del Mar at age 17 had CPAP insurance, and her parents, under her parents, and she came into the hospital, St. Peter's Hospital, and she was overdosed and brought back. Her father had resuscitated her before she got to the hospital, which helped a great deal. And they brought her back. She was in intensive care, and still the insurance company would not authorize her to go into rehab. A second incident occurred. She was also arrested, so this was a big help to her. So I asked the courts also to intervene and to allow me to say something to the insurance companies that would indicate that they would be held responsible for what was going on down the line for the safety of citizens as well as this young woman. And facility, a long-term treatment facility, because of her age. At age 17 is a very difficult age to get anyone into a facility, except for possibly past adolescent, which is really the only one around right now in our area that's a residential facility. We do use it.
Could you say the name of that program again?
Sorry?
Which facility? Is the only, which facility?
Hope House.
Oh, Hope House.
Hope House Adolescent, yes. And they are very good, very successful, and we have 2 people there now. But I think this incidence that occurs, where the insurance company denies people, children or young people, because they have not failed at an outpatient. That would be the criteria. You must fail at outpatient before you're allowed to proceed to inpatient. That kind of criteria, where for the person's mental health, she needs more of a diagnosis than what you're giving me. She hasn't really been diagnosed with a mental illness at this point in time, perhaps. So insurance obstacles are to someone receiving treatment, that is one of them. One of the other areas that I saw in an arrest of a young woman recently, she was buying quantities, that would supply to herself and her boyfriend. And it looks then on the outside that she may be a seller, which she is not. She is just, got a little money together and bought what she needed. I think looking at the reasons for her use and maybe more work with the schools, I think needs to occur, because she came from a school where there was incidents of 13 adolescents in 2 years dying from car accidents. This is in Rensselaer County. And they were celebrating the life of one of the teenagers that had died. And they don't have enough, it seems to be, opportunity or avenues to celebrate the life of someone who has passed away, where they can't understand, they can't comprehend young people dying and just disappearing, and nobody celebrates their life. But that was one of the things she talked about, and I thought I'd bring that out, that maybe schools need to talk to young people instead of the reaction when she was arrested was that she was a bad person and she needs to be punished. And I think they need to look into it a little further to see why these adolescents are celebrating in this manner. Don't they have other ways to celebrate the life of their friends that died? So I think also, as others have brought out, the cost of the pills, of the opioids that do exist, they're so available. And it's, when they're expensive, when you're trying to get them on the outside without, when you're going on the, and when you go and try to, the internet or other means, and you try to get your substance, it's a lot more expensive than it would be if you just got a prescription. And a lot of them don't seem to know enough about trying to get prescriptions the way adults do, which is what I see when we have adults that are in the same problem.
Mr. Phillips, you mentioned that outpatient goes before in-house treatment. How would you professionally characterize that type of treatment with someone who has been addicted to heroin? Is the outpatient something that would more of a band-aid approach that probably won't work?
I think it's not that outpatient program wouldn't work, but when you get someone who's overdosed at that stage of their life, it's a very traumatic event where they've overdosed and almost died. And I think they need the kind of intervention they need is very intensive, and they need to be removed from whatever setting they came from. not necessarily mentally healthy.
In your role in police court, how have you found insurance companies to deal with in terms of covering?
In earlier years, I've been, as Mr. Bresson knows, I've been doing this for 30 years, and in earlier years, it was not as difficult to deal with the insurance companies, but now it's much more difficult to get permission for someone to enter into any kind of residential treatment. It's like the last thing that they want you to take a look at. Even though you have somebody, these adolescents, these young people have been using pills for years, 4 or 5 years before we actually see them using heroin. And they tried everything they could to stay with the pills. And once they tried the heroin, they love it, and they stick with the heroin and it's cheaper. And so that idea that you can just take somebody and take them to the hospital and then put them in an outpatient program and everything's going to be all right, it just is not possible. It's not possible to do an evaluation that's sufficiently on a person. And I know the trend is away from inpatient treatment programs because of the expense. And I would maybe challenge OASIS to take a look at the requirements that inpatient programs have and staffing, and maybe try a different model or different models, different kinds of models, so that it may be possible for them to continue. But generally speaking, unless you have a psychiatric or medical problem that's co-occurring, you're not going to get somebody admitted to an inpatient program.
I might add that Sister Phyllis has been joined by Father Peter Young.
Sorry, I will be back and I apologize.
Would you like to add anything to that, Father Young?
Yeah, sure. It's really a treat for me to be here because I was not in this room, but in the Capitol 54 years ago, trying, if I could, talk about the same problem, the heroin problem. At that time, one of the senators said, that's only a Harlem problem, Father. Don't worry about it. And wow, that hit me very hard because I was working on Green Street in Newbrook, Albany. You know, that was a containment of crime area. There were 12 blocks there. In that 12-block area, you could shoot up on the street, you could shoot all day, put the needle in your arm, and sit down and relax on the curb. That was our Albany scene 54 years ago. And I was there, I was the pastor of that neighborhood, and I saw the damages that were done. It was there to contain crime. But it was the heroin problem on Green Street and in the city of New York, in the neighborhood of Harlem. And that's the only people that were talking about heroin at that time. Now we've progressed to it being a problem. I got to know today a very serious problem in Greene County. Wow. Greene County, heroin in Greene County, a lot of it in other counties. All the way through the state. So we have over 5,000 clients a day, every day, in 117 locations. And we have that kind of a problem wherever we go in the state of New York, from Brooklyn to Buffalo. The woman that knows well what we're doing in Triton and sort of skeptical what we're doing in Harlem. And not in Harlem, but in Brooklyn and their neighborhood, because they've been very supportive. So we're very grateful to the senators that have done this because they brought it to the attention. And you have done it today by you being here and being able to put this table into an idea of putting it on the idea of what priority list might be in the Senate this year. So I'm very eager. It took a long time, 14 years of my life, to try to decriminalize and make addiction disease. 35,000 meetings, meeting and greeting the senators and the assembly people. 35,000 meetings in 14 years of my life. And it's a disease, it's an illness, a progressive and serious disease. I heard Sister Phyllis said it's a progressive, that's the key word. It's got to go to the mesothelioma brain. It's that kind of thing that I worry about. People don't understand that. And they look at it as another problem that they brought on themselves. They don't bring it on themselves. They're predisposed, and they're caught by this appetite, and that appetite goes right to the dopamine that they have in their system. It goes to the neurotransmitters. It goes to that reward center of the brain. And that's what we've got to concentrate on. How do we do that? We need your help.
wanted to, I want to thank Senator Breslin as well for bringing us here. I know you didn't intend for us to have a snowstorm to come through to get to the hearing. And Father Young, I want to absolutely thank you for the many, many years. It's many more than 14 years, by the way, that you've spent of your life on this issue. And I just want to be on the record on something that is slightly different, but certainly related to this question. And both you and Sister Phyllis have indicated that this is a progression.
Yes.
And that young people become involved in this process earlier than when they finally end up overdosed.
Yes.
So I have been very, very long and adamant about the fact that we should not means test critical services for young people, because it almost doesn't matter how wealthy your parents are. If you were a teenager in Harlem, or a teenager in Niskayuna, or a teenager in Greene County, as you indicated, there are certain issues that you are faced with as a young person. That's my belief. And so I hope that this becomes part of our platform as it relates to the needs of young people to have health and mental health services available to them in the way that they can access those services, no matter where they are in our state, and no matter how wealthy or not their parents are. We should not withhold services to young people because their parents are wealthy, under the assumption that money makes you whole. And I think both of you would certainly agree with that money does not give you automatically completely healthy mental state. There are other needs that young people have. And this hearing, it seems to me, my colleagues, is a clear indication that we need to do a better job of having mental health as well as health services available to young people in our state, across the state. Doesn't matter what their parents' income is. That's my platform, that's my political platform. And I hope that we can work more together on making sure that we begin to build a health and mental health system that serves young people in our state much better than we have.
Oh, yeah?
Yes, I certainly thank you, Senator, because that's so important. But when it came to the Timothy's Law that was implemented to try to provide funding, we as addiction, as a field, were eliminated from any kind of funding source. All other mental health sources were funded through Timothy's Law, but we were excluded in the final bill. And I think that might need another look. So we would appreciate it if you could look at Timothy's Law. It is becoming an epidemic. It needs to be addressed, and we beg you to try to do that. And in the 54 years of doing the same thing every day, advocating for addiction, we need it now more than ever.
Thank you, Father Young. Senator Kachik?
Father Young, I want to thank you and everyone who works for your program, for the services you've provided over the years. And you've helped a lot of families, a lot of people recover from addiction. We're talking earlier about housing programs, and I wanted to get your sense of, were there enough available long-term housing programs for people who are dealing with heroin abuse? And I know your programs only for adults, and are there enough programs available for young people who are below the age of 18?
I tell you, but there are never really enough. For many years, I ran the ASAP, started and founded the ASAP program in the Department of Correctional Services that Senator Montgomery, our are very familiar with, because they supported our opportunity of putting a program in her district, and she was totally supportive of it. And we're very grateful to her for that, for 150 beds. But one of the things we're doing right now, we're pulling out of residential care because we're doing it tomorrow, and I'll be hoping if I can to sit down with whoever will be able to be in dialogue with me because of the millions of dollars of money we've lost this year. We're losing millions of dollars of money because we're operating on outdated rates. We're operating with old rules and regulations and filing more than 100 million papers responding to the state request for documentation. When you're filing over 100 million papers for documentation, it wears all of the counselors out. It's where the counselors speak about working in the field. They don't want to work in the field anymore. All you are a paper pusher. You're not doing anything that benefits. You can't get time to talk to the client. You're paralyzed by paper. And that's something, if you're in the field, you're going to find it out very quickly. People are walking away, and we're going broke. We're going bankrupt because of the lack of funding. It's the 14-day limit. Goodbye. The guy's not ready, the girl's not ready, and they're going back out on the street without any time to care. We're extending ourselves, and we're not getting any funding from the counties or from the state or from the feds to make that happen. And it's a sad kind of state because we're pulling out. You're going to see a lot of empty beds. We're praying we can hang on to what we can, but we've lost millions this year. And our finance committee met this Monday. We're meeting tomorrow as a board, and we're walking away from many of those valuable beds that Senator Montgomery just spoke about.
Thank you very much, Madam. Thank you very much for the good to see you. Continuing on in the not-for-profit sector, I believe we have someone from Hospitality House located in Albany. Tammy Manoli here. If you could each state your name, who you represent, and then you can choose between yourselves who goes first.
All right. I'm Tamaya Manley. I'm the Associate Director for the New York State Office for Fighting Crime and Investing Kids. We work with law enforcement leaders across the state, chiefs of police, sheriffs, DAs, and survivors of violent crime to leverage their voices as unexpected messengers in support of group investments in children.
Hi, my name is Young Doe. I am a police counselor at Hospitality House. Unfortunately, I actually only heard about this hearing yesterday. My executive director, Linda Becker, was not able to be here. Hospitality House is a 9-12-month long-term residential program. Most of our clients, probably about 99% of our clients, are mandated by the criminal justice system. Generally, the average months that they'll stay is between 10 to 11, but we do have clients that stay at home. I just came with just some statistics. So as of December 2008, for our program, out of all our clients, the primary drug of choice that our clients were reporting when they first came into treatment, 16% was marijuana, 26% was crack cocaine, 41% was alcohol, and 17% was opiates. As of this year, about 70% of our clients are now reporting some sort of history of opiate use, and about 50% of our clients report that heroin or opiates are their primary drug of choice. As far as with our clients, I think that it's obviously we have this this view that from the past, from what we see in movies or on the streets that our heroin users are from the streets, they're from low-income families, and that's actually changing. The counselors now have to kind of look at different typologies now. So in my history, from working in Hospitality House for about the last 10 years, typically, we used to have heroin users who are a little bit older that generally come out of New York City, they moved here. But now we're seeing from the northern counties, from The average age that I would say for our clients is about 24, 25. Actually, in the last month, we lost 2 former clients that went to chemicals in the last month. They were heroin overdoses. One was actually a heroin overdose with another drug, which was fentanyl, which is a kind of a transdermal type opiate that is very high potency because it's designed for a long-term release. So you put the patch on, it releases over a period of 24 hours. They are taking these patches and they usually suck on them to get the chemicals out. And so they're getting a very large dose in a very short period of time. They're mixing it with the heroin. So when somebody goes out to buy heroin,